really appreciate Dr. Tara Odesky, who has graciously agreed to do an interview about her rosacea method. And just to give you a little background on her, she volunteers on the RRDI MAC, and she's developed a rosacea method, which she allowed me to take the entire course, all the modules, and I did. And I really feel that this will help many, many rosaceas. And so I thought I'd do a little interview with Dr. Tara. So let me give you my first question. Without revealing the entire rosacea method that you use, can you give us an understanding, because there was two things that came up that I know that rosaceans are going to have questions about, is the holistic treatment that you're offering versus the allopathic treatment. Can you help us understand the difference between these two treatment modalities?
Sure, absolutely. Thanks for having me on. So basically, most people with rosacea are going to the dermatologist and having this allopathic treatment, which is basically an approach of, here's the condition and here's the treatment. So we approach most health conditions here with this type of treatment. You know, we go to the dermatologist, they offer antibiotics, they offer cortisone, they offer topical treatments to your skin, possibly antibiotics, gut health, that type of thing. But unfortunately, that's not really what we want to be focused on, because if you look at a holistic treatment option, it would be to start with what's actually going on to cause this from happening. So rather than just addressing the symptoms, a natural approach would say, you know, why do you have this inflammation? Why, why is this happening? Why are you having these gut issues? Most people with rosacea are having other symptoms in terms of just skin rashes. They're having a lot of times gut issues, a lot of times other toxicities, other toxic exposures, and it's causing a host of symptoms. So if you look at all those and figure out what's causing those, chances are you can actually get to the root of the skin issue as well.
Oh, good. I think that'll help. Now, I did take the course, and I know that this course can help and improve someone with rosacea. I would describe the nutshell version of your whole course, the Rosacea Method, as eliminating toxins, changing your diet and lifestyle, and then you also address emotional concerns. And those 7 modules really do this in an excellent way. I want to really commend you on it. But how would you describe the Rosacea Method to our listeners in a nutshell version, or better yet, can you give us some details as much as you can?
Absolutely, yes. So I get a lot of people saying that. The biggest question is, I've tried everything. People with rosacea usually have years of jumping from thing to thing, saying, okay, well, maybe it's diet, maybe, so I'll eliminate this thing, and that didn't quite work, and I'll try this, and someone said to try this. And, I did it myself for 20 years, like jumping from thing to thing, trying to figure it out. And so I basically put all those things together that we hear about. Maybe it's related to histamines, maybe it's related to mold, maybe it's related to smoke, maybe it's has something to do with anger and holding on to emotions. So when you actually put all those pieces together into a program that addresses all of these, so let's go back, let's evaluate what's in your house. Could you be sensitive to something you're breathing? What's in your water? Could you be sensitive to fluoride? If you take a look at all those things, it doesn't mean you actually have to go and change all those things, but you want to at least address it as a possible cause of this chronic inflammation. And so that's what it's basically doing, is educating people about all those things that could be, causing symptoms, and then, offering ways to actually go about changing them.
Yeah, I really liked the module on the emotional aspect of rosacea, because you really helped me to see clearly about this, because everyone knows that stress is a rosacea trigger. I mean, it's on every rosacea trigger list. And just tell us what you can about that emotional part of your module.
So what we did was we had a workshop with some experts, and we got together and we talked about skin conditions specifically, and how it relates to not just stress, but perhaps things in your past that were traumatic that you never really let go of. Because in traditional Chinese medicine, they believe that these emotions are actually stored in organs. And I 100% believe that there's a connection with rosacea and anger and resentment. And I find that with so many of the patients that I work with, they are holding on to these emotions. And when you actually come to a place where you can let this go, or at least understand what was causing it and that it's actually affecting your health, a lot of people are able to let it go, and they see a remarkable change in their rosacea. And also learning how to deal with stress so that it's not a trigger. Learning how to kind of, address it from a point of view of, if you're living in this chronic state of stress that so many of us are today, it's having a major impact on your health. So what we can do to actually change that.
Oh, good. I'm really glad that you're able to talk about it, because that expert panel, I thought that was like the crown jewel of your Rosacea method. You assembled these experts that helped me to see, anyway, something that many rosaceans are probably not aware of at all. And it's really good that you address that. Now, the other thing is the Rosacea Research and Development Institute, the RRDI, is the only nonprofit patient advocacy organization that recognizes gut rosacea, okay? And to me, you have confirmed the gut-brain-skin connection in rosacea. So can you explain to us why the Rosacea method connects this gut-brain-skin connection in healing rosacea?
Yeah, and I have to commend you for the RRDI doing this and having gut as one of the major underlying causes, because I'm shocked at this day and age that we are not all saying that gut is absolutely connected to rosacea, connected to all skin conditions for that matter. 80% of your immune system resides in your gut. So, if you get sick for any reason, any sort of a health issue, the first thing you should be looking at is your gut. And it's fascinating that we're not talking about gut on a regular basis. Even if you bring your dog, to the vet and your dog has this skin condition, the first thing they do is change the dog's food, right? We all know that. We know this when it comes to other plants and animals, but when it comes to humans, we have a very hard time acknowledging that what we're eating is actually causing health conditions. So the gut-brain connection is this direct connection between your brain and your gut. So, if you have thoughts of suddenly anxiety or, oh my gosh, there's a bear, you immediately have this reaction both in your skin and your gut. Like sometimes your stomach will do a flip, sometimes you'll have this urge to go to the bathroom. And sometimes your skin will get very clammy, and that's this connection. So it's this direct connection. And not only does it work that way with the brain affecting the gut, but it works with the gut affecting the brain. So if your gut is in this chronic state of inflammation, as so many of us are today, that's going to have a direct impact on your brain and anxiety and depression. And they're finding this now, that the research is saying that people with SIBO and H. pylori and IBS are now much more, it's much more common that these people will have things like anxiety and depression and things like that. So luckily now they're making this connection. We know that it's absolutely all tied together. And I'm really happy that the RRDI is addressing this. And I hope that this is kind of the next stage of where we're going with the research for rosacea.
Yes, that one expert said an illustration of a red and a blue cord in your spinal cord. I thought that was a great illustration. And then the other one did this one, which was the butterfly thing. And that's our logo, the butterfly.
Exactly.
and,
yep.
and she said, you can use this.
Yep, I know.
I love it. And I just really think that module will really help a lot. Now, you make it very clear in the rosacea method, over and over, you keep repeating this, that there's really no time frame, that all rosaceans are different. They'll get improvement or heal their rosacea with different time frames, depending on the individual. So you mentioned this might take up to a year, but in some cases, you usually see improvement in a month. So with so many factors to consider, can you help us understand why the time frame to heal rosacea with the Rosacea method may take longer for some, shorter for others?
Yep, that is a great question. So for I'd say about 50% of the people who take my course, they are actually reacting to something on a daily basis. So this could be, like I said, something in their air, something in the water, a food sensitivity. Most food sensitivities, you have to understand, are not diagnosed. Even though people have gone and had this allergy testing done, I had allergy testing done, it didn't show a single thing. And yet when I actually eliminated dairy and gluten, my skin improved drastically because I actually am sensitive to gluten. The reason I know that is because when I eat it now, I have a reaction the next day. But this is something that won't be determined in a food sensitivity test. Even the top allergists will say that the only real way, the gold standard in allergy testing, is to eliminate that food for a full month and then bring it back in and watch for reaction. So I'd say that most people are actually sensitive to one or two foods and they just don't know it. So when you've eliminated that food, which the program will tell you exactly what foods you're going to eliminate for the month, a lot of people will see major improvement within that first month. For everybody else who doesn't see major improvement, in a lot of cases, there are other factors like we talked about. There could be emotional factors. There could be built up toxicity. Mercury toxicity is a huge one with people with rosacea. Histamine sensitivity, hormonal imbalance, like there's a lot of other things going on that we get to in the following months. And I have people write to me, a year later, a year and a half later and say, it took me a really long time, but I was, pretty consistent with what I learned and look at my skin, and they show me before and after. So I'm thrilled when people learn enough to make the changes over time.
Oh, that really helps. I'm sure that's going to help people understand, because I know that your course is not for the faint of heart. You really have to commit to your method. And I really feel in my heart that if someone would try this, it will help their rosacea. Now, if someone's considering your treatment, what would you say to someone who says, well, why should I try this? My dermatologist recommends that I continue with this regimen. What are you going to tell that one?
Well, of course, you have to start with your dermatologist and get your diagnosis. And once you've gotten your diagnosis, if you're trying that and you're not seeing improvement, we always suggest looking at other options. Can you go to a naturopathic doctor? Can you go to a nutritionist? We know that rosacea is connected to other things. So at this point, if you're not getting the help you need through medication and you'd like to try to address the underlying causes, then that's when you can take it upon yourself to really start diving in. Unfortunately, there's not a ton of research out there on the underlying causes of rosacea. Most of the narrative right now is that we don't know what causes rosacea. But I have to disagree because I'm fairly confident I know what causes rosacea. It's just a matter of actually taking those steps and going through those, some cleanse protocols and some changes with your environment, addressing stress, like you said. And when you actually make those changes, people see dramatic changes, not just to their skin, but to their health overall.
Yes, we have documented over 20 different theories on the cause of rosacea. And there's probably many, many more that we don't document because we don't really know. So I really hope that people will benefit from this interview and that they will try your Rosacea method. And we really appreciate that you volunteer pro bono on the RRDI Medical Advisory Consultants. And thank you so much for your participation.
You are so welcome, and I am more than happy to help in any way. When my rosacea actually reversed 100%, I was so dumbfounded that I just felt absolutely that I had to start at least sharing my own story to inspire others, because up until then, I wasn't ready to take that as an answer. So when I actually saw what happened, I just felt, the need to share it with others. So I'm very happy to be here and help in any way that I can.
Oh, good. Same thing happened to me. When I went to, my diagnosis for rosacea was in the 80s, like 1985. And the dermatologist told me, well, you got to just take tetracycline for the rest of your life. That's what he told me. I said,
Yeah, I know.
and I did it. I did it for years.
Yeah.
But then there's other ways to treat this. All right. Well, thank you, Dr. Odeski. We really appreciate your participation.
You're so welcome.